Hi, this is Wendy, and tonight I'm going to discuss some obstacles in accurately describing neglect and determining if a child is being neglected. When speaking of neglect, I will explore it from the Western viewpoint with our laws in the United States as reference. Our text is Understanding Child Abuse and Neglect by Cynthia Crossan Towner. And the text explains that neglect differs from other types of maltreatment because it is an act of omission, usually related to parental deficits. The main types of neglect are physical neglect, emotional neglect, educational neglect, mental health neglect, and medical neglect. The first obstacle to hurdle over in describing neglect is the misconception that neglect happens only and in every poverty-stricken household. There is no research that says that poverty is a reason for neglect. There is a correlation between the two, however, but it does not happen all the time. There's also cultural considerations to be looked at when discussing neglect. Child-rearing practices and beliefs widely differ from culture to culture. What is done in one culture may be perceived as neglect in another. And this happens because there is no universal standard for optimal child rearing. A couple of examples. Harsh initiation rites that include deprivation of food and sleep and induced bleeding and vomiting in some African cultures are normal and thought to help a child, whereas here in the United States, we would determine that to be abuse. On the other hand, people from other cultures would see Western culture as neglectful in some of our child-rearing practices. Not attending to the baby immediately when the baby is crying, or having the baby sleep in its own bed instead of with the parent. They would see that as neglectful, and we do not. Neglect is less dramatic than other forms of maltreatment. Some things that we see in children who are neglected: there's inadequate bonding between mother and child. The child may have a failure to develop self-esteem. The child may also develop some language deficits. There are gross motor and fine motor deficits seen in some children. And as the children get older, they lack friendships. In 1967, the Child Level of Living Scale was developed to help American workers determine if neglect was happening in a household. However, it had its limitations, culturally speaking. It was developed first for use in Appalachia and later in low-income families in Philadelphia. Then after the CLL scale, the Child Neglect Index, or CNI, was developed. And this scale was developed to help protective workers make determinations of neglect. This particular scale was developed for use in Ontario, but it has been determined that it can be used in other geographical areas as well. The CNI scale assessed neglect in 6 different areas and gave a point value, and the higher the point value, the more neglectful or the more neglect is happening in a household, and it'll tell us if the child is at risk for being neglected. The problems of neglect are less obvious than other forms of abuse, but research suggests that neglect is much worse than abuse and the effects last much longer. Intervention for neglect is a gradual process that hopefully over time will help the child in question. Have a good night.